All right, you're welcome back to New Day. Yes, we're live from the studios of TV3, First in News, Best in Entertainment. So, the state of Ghana's mental health care system is disheartening to say the least. And now we're faced with the likelihood of the discharge of some 300 inpatients at the Accra Psychiatric Hospital. I'm sure the rippling effects are not lost on all of us. Well, this morning we're looking at the state of Ghana's mental health care system and the challenges as well as the way forward. My guest this morning, Mr. Kweku Brobe. He is the head of communications at the Mental Health Authority. So, Mr. Brobe, you're welcome. I gather everyone has a bit of mental disorder. When last did you check yours? Let me know if I'm speaking to someone who has complete sanity.
Well, fortunately for me, I've had the benefit of being around, psychiatrists, and lots of them,
right.
Perhaps the best we have in the nation, and if I'm not afraid to say, some of the best we have in the world. And
yes.
So fortunately, we go through some form of informal assessments. And so I think and I believe that
you're completely sane.
I'm in the line of sanity.
All right, okay, well, you're welcome.
Thank you.
So a quick one, with just the physical observation of unrestricted, frail and helpless mental health patients we see roaming our streets, wouldn't it be apt to describe our mental health care system as broken down?
Broken down, well, maybe to some extent, but again, I wouldn't say completely broken down. I think the mental health system in Ghana has just not been given the assistance that it needs. I think we have not prioritized.
Hence the breakdown.
Definitely.
So it's broken down.
Broken down. I maybe I wouldn't use the term broken down.
What would you
I think there's been lots of lapses, and there have been gaps, and these gaps have to be filled. And the Mental Health Authority has come in to help, fill these gaps.
I will ask about what you're mandated to do as an authority, but just so we can define the state of our mental health care system in Ghana. On Saturday, 12th October 2013, this was just about 3 years ago, the Ghana News Agency reported Dr. Kwesi Osei, to have said that Ghana's current mental health service delivery has a 97% treatment gap, explaining that 97 out of 100 mental patients who require care do not get it. That is a broken down system. 97 out of 100, that is broken down.
Well, I think there's a problem that's not, we do not, have this just in Ghana. I think the entire continent, and it's...
Well, may we not do a comparison?
Well, of course,
let's deal with...
The situation is that mental health has not received the kind of priority that it deserves. And it's not...
I agree. I'm saying that has resulted in its breakdown.
Well, fine.
If 97 out of 100, I want you to be able to agree to some extent. If 97 out of 100 mental patients who require healthcare do not get it, that's beyond grave.
It is, but you're probably trying to impose the term broken down on me. But we know that there are lots of failures. There are lots of things not going right in mental health, but the system basically has not. A completely failed system is what you call a broken down system. There are things, we know what to do, we know what is right to do. The problem is that we have not had the resources, to get it to where it has to be. That is the problem we're facing now. So it is not an entirely broken down system. We have the expertise to get it to where we have to get it to. What we do not have and what we are not getting now is the resources. That
you're saying we actually have the expertise?
We do have the expertise.
I beg to differ. I know that the field of mental health, in Ghana is vast. We have clinical psychologists, we have psychiatric nurses, we have psychiatrists. How many clinical psychologists are practicing currently? Would you know?
Well, we don't have much of those.
We have 4.
We have,
as of the last time, in 2013, we had 4.
Yes. but at least four is something to begin
that's
with.
not
isn't
enough
it?
expertise.
It is not enough. But when we talk about expertise, it's about having them. I mean,
Yes,
are
we
they
want
available?
having the professionals.
Yes, so we have a few of them available, and they are in a position to train others. The point is that, do we have the resources to get people to come in? Do we have, I mean, what it takes to motivate
Yes, the
people to
human
come
resource,
in?
Mr. Brobe. How many practicing psychiatrists? We have 12. Now, for
Well,
even low-income countries, the required number is 150. We have 12,700 psychiatric nurses instead of 30,000.
Yeah.
That's you can't say that we have the expertise. You can't say that we have the the required number of professionals or workers in this vast field.
I think you need to redefine it.
Yeah.
What you're saying is that we do not have adequate number of people, the adequate human resource, but the experts, we do have them.
So the 4 clinical psychologists we need instead,
They are
we
experts,
have
aren't
instead of the
they?
100 we need.
Those people
that's enough. That's adequate.
Okay, so what I said is that the numbers are inadequate, but the people do exist. We do have the
So
experts.
it's enough
in that.
expertise.
It is not enough,
Okay.
and that's why I'm saying it's inadequate. I mean, the numbers are inadequate, but we do have the people, and we have. I mean, they are in there to train people. If we have the resources, if we have what it takes, if we have the what it takes to motivate people to come into the various areas of mental health, definitely we will get them.
What is the role of the mental health authority in bringing some sanity into mental health care system in Ghana?
Well, the mental health authority basically has an oversight role of mental health activities throughout
So it's
the
more
nation.
supervisory?
Kind of regulatory role. Yes, that's what we're supposed to do. And we have a responsibility to propose mental health policies and ensure that, those policies proposed are implemented.
Okay. So are these proposals binding, legally binding?
Well, we are backed by an act, a Mental Health Act, and that's a legal. It's the Mental Health Act has legal backing, okay, and so it mandates us, it gives us, the legal right to propose these policies and implement them.
Okay. I know that the Act puts more emphasis on community care and less on institutional care.
Sure.
May I know why that is?
Well, so over the years, what we have done is that we have concentrated on the 3 psychiatric hospitals. And those that's what we call institutional care, bringing people in there. Mentally ill people,
Yes.
keeping them within the facilities, and treating them within the facilities. Now, what we're saying is that no, and again, we have done an assessment to find out what it is that, the advantages and disadvantages of this system. And I think we've come to the conclusion that this system has given rise to lots of stigmatization, lots of discrimination, and again, it kind of confines mental health to a particular, area. Or we see mental health as cladded in some kind of straight jacket, because if you talk about mental health, you're talking about the Accra Psychiatric Hospital, you're talking about the Pantan Hospital, and you're talking about Ankafull Psychiatric Hospital. But what we're saying is that no, that is not mental health. Mental health can be seen in our communities, the communities where we live. And for anyone who suffers a mental condition or some form of a mental illness, the person should be able to walk into any health care facility and receive treatment for the kind of illness the person is suffering from. So it's important that we kind of decentralize, so to speak. And that's how come we have trained lots of community psychiatric nurses. They are in the communities, and these people are helping to, give what we call the first line treatment to people who suffer mental health disorders. Now, we're not going to
On what authority do you speak? Do you, have a system by which you monitor and evaluate, in fact, even assess the impact, I suppose, yes, the success with these community psychiatric nurses?
Definitely. This entire program, is a structure that the Mental Health Authority has set up. And so you don't just set up a structure without, having in place monitoring or evaluation programs.
Yeah.
So all these are in place, and over the years we have come to realize that it is much more effective having these people in the communities.
Do you have figures? Do you have numbers with which you can back what you're saying?
Well,
claim?
unfortunately, as I sit here now, I do not have the data, but of course, we do have some figures to that effect.
So you're saying that we have made some substantial advancement in mental health care in Ghana,
definitely,
owing to the Mental Health Act?
Well, of course. Mental health is improving gradually. It's improving. You have not seen that vast improvement or that significant improvement because, as I indicated, we've not had the resources to move it to the level that we want to move it. Yeah. If we had the resources available, I think the kind of impact would have been so visible to everyone.
I like quoting Dr. Kwesi say, it's like, hearing from the horse's own mouth.
Yeah, he's an authority.
Yes, I do. In a recent study, he said that, it had been found out that Ghana had 41% prevalence of psychological distress in various degrees, meaning that as many as 41 in 100 were admitted and they had negative stress, which affected them mentally. And then out of that, 19% of those, just about half, with the negative stress had moderate to severe symptoms, meaning the problem was serious enough to be considered a mental illness. Now, here we are faced with the possibility of the discharge of some 300 inpatients at the Accra Psychiatric Hospital. What's your assessment of the magnitude of this problem, of the gravity of this problem? Some have considered it a threat to national security. Would you agree?
Well, mental health itself is a national security, issue. Okay, the safety of our communities, the safety of our society, well, to a large extent, or to some extent, depends on the sanity of people within the society. Now, it is up to us to be able to decide. Look, recently I came across a document that said we sometimes took lots of things for granted. For example, with the the advent of terrorism all over. Yeah. You ask yourself, how safe are our communities? You never can tell. If you live within a community, say somewhere within cantonments, and you think you are safe. The only thing that can get someone, an intruder, into that community is when the person poses, for example, as a mentally ill person. What do you have? What legal backing, what clout do you have to go in and ask the person or remove the person from where the person is? These are some forms of monitoring devices that people who would want to do some harm will come in. They pose as mentally ill people. They stay on the streets. They are able to monitor you over time, and they can come in and do anything to you. Yes. So there are serious security issues here, and I think the more we take a look at these things, the better it will be, or the earlier we take a look at them, the better it will be for us.
So what has the authority done since its institution?
The authority, for example, somewhere on that in this light, we have several programs, and one of these we call clearing the street. I think it's such a laudable program that if we had had the support of society, if we had had the support of stakeholders, all other stakeholders, in clearing our streets of these people, of the mentally ill, when you have been able to clear us, if for example, in a period of say 5 years, you would walk our streets of you would walk the streets of Accra, you walk the streets of Kumasi, you walk the streets of Tamale, any place in the country, and you do not encounter a mentally ill person. How would you feel? Imagine how clean our streets would be to some extent, because of course, these people have contributed.
So you embarked on this project when?
It is still ongoing.
Okay.
It's just that it's on a very small scale, because at one time you can go in and we go in.
Why so? Why is it on a small scale? If it's this laudable, in fact, it's a noble initiative, why not go all out?
Awesome, and that's the million question that we should be asking. The point is that it takes a lot to be able to get people off the streets. It takes a lot, because you just don't get get them off the street and put them in there, like, I mean, some you know, unwanted things. They are supposed to be treated. We move them off the streets, we bring them into the facilities, we treat them to an extent where they can go back into the society, reintegrate into the society, and become, I mean, normal people like you and I mean, so to speak, normal, so to speak. So that is what it is. But the problem is that we have not had the fund. We're not getting the funding to do these things. It takes so much to move one mentally ill person from the street. It takes so much money. It takes so much effort. It takes so much what human resource to do that. Unfortunately, we are not getting these things. If the act is legally binding,
I'm sure there are policies in there that should be legally binding on certain authorities to provide funding. So why is this not forthcoming?
Well, that will not be for me to say. That perhaps will be for
you're the communications officer of your
well
authority.
I mean, no, I'm looking at it from the angle of, I mean, implementation of I mean, Ghana traditionally has had, I mean, beautiful laws. I mean, most of our laws have been crafted in the most perfect way. But how has the implementation of these, I mean, laws been?
I think it's quite unfortunate that even you would speak this way, coming from the authority backed by the Mental Health Act. That almost rubbishes the whole point of the act, doesn't it? If we can craft beautiful policies, you know, and laws, and implementation is nil.
Well, to the best of our knowledge, we would have loved to implement it to the letter. The point is that you need something to help implement these, I mean, laws, these beautiful laws as they are crafted. What does it take? You need the resources to do these things. Unfortunately, if you are not getting the resources, and look at how we go around, we keep struggling, we keep talking to, I mean, government agencies, we keep talking to corporates, we're talking to individuals to come in and help. Unfortunately, help is not coming. If you are not getting the help, if you are not getting the funding to be able to run these things, there is not much that you can do. And that is why, in our own small way, we have not sat back and, I mean, thrown our arms in the air and said there's nothing that we can do. We have, I mean, still embarked on clearing the street, and we're doing a lot, we're making lots of inroads in those areas. So very soon we're going to come up with some of the videos.
For clearing the streets? Are we looking at a number of mentally ill people, unrestricted people walking on streets who are taken off on a weekly or monthly basis? Do we have a number?
Again, it depends on, you know, for mental illness,
yes,
you really cannot say, it's gonna take about a month or two to take, I mean, to get a person, I mean, out of his condition.
Yeah.
It depends on the kind of condition the person finds himself in.
Out of the condition on the street, we're taking them off the street into
okay, so we take them off the street, yes, we bring them into the facility. But the problem is that our facilities already are overcrowded.
That's right, yes.
We are overcrowded, yes, in there. So how many people can you move in there?
So what's the point of the Clean the Streets project? Well, because there's nowhere to take them.
Well, so there's nowhere to take them, but and that's why we have embarked on what we call, again, the repatriation exercise. Accra Psychiatric Hospital used to have, I mean, a little over 600, I mean, patients in there. Over the years, we have reduced the number. Now we have about 450 patients in there, and we're still working, I mean, to move.
What's the capacity of that hospital? How many inmates can
Accra Psychiatric Hospital was built to take up, I think, about 300 patients, and that was improved over some time, but I mean, you have so much people coming in, and it's not the best.
Well, maybe I'm pinning too much of the blame on you. Let's see if we can pin the blame on somewhere else.
Well, I mean, we don't have to send it to someone else. I think we should
I want to see how many contributory factors there are, so that it's not just with you and administration, you know, of the act, you know, but perhaps even culture. And in Ghana, as is true of most African cultures, mental health or mental illness has some superstitious definitions and interpretations.
Sure.
That's why I want to know to what extent cultural beliefs contribute, you know, to the problem we're faced with.
Well, to a large extent, I mean, traditionally we have been superstitious, and I mean, over time.
Yeah.
I think gradually there's been a shift from, you know, that kind of superstition, and now we're moving more into well, it's still a superstition because we're moving more into a religious realm where we now, I mean, if someone suffers a mental illness, the person, probably the first point of call for most people is going to be some faith or, I mean, based healer or something, you know. And there are lots of these prayer camps and all over, but again, having assessed, I mean, these prayer camps and, I mean, faith, traditional faith-based healers, what we have come to, we came to the conclusion that, okay, we are not going to be able to take them completely to, I mean, to stop people from going in there. So we decided to work together with these people. And that's what the Mental Health Act stipulates, that we work together with the faith and traditional-based healers. So we're able to, you know, probably train them to some extent, let them know the extent to which they can help some of these people. And those that they cannot help, we either send, I mean, professionals in there to help them, or they send, I mean, the people, especially when it's when the person needs institutional care, they will then send them to our
so talking of collaborations, how about with political parties? Is your outfit conversant with the mental health policies of the two major political parties, the NDC and the NPP, what they have stated they would do?
Well,
is your authority even, you know, concerned about this? Do you investigate what these parties say?
Of course, I mean, we got copies of their manifestos, and I mean, because we are into mental health, we looked at. Well, of course, I think
assess the feasibility, the practicability of
exactly. I mean, to the political parties, they have, I mean, probably thought through what they think is right for mental health, and that's how come they've come up with those policies. Some of them,
so none of them liaise with the mental health authority, well, even in writing those promises.
It is possible that there might have been some level of consultation.
But you're not in the know. You're not in a position to say.
Well, I mean, but what we're saying is that if, for whatever political party comes to power, we will want to sit down with them as, I mean, as stakeholders, and I mean, have some stakeholder engagement, you know, sit down, decide what is right for mental health in Ghana, and then we go by those policies. So whatever they've come up with, for those that we think are, I mean, are laudable, definitely we'll go with them. But there are those that we still think we need to have discussion on.
What's the communication structure between the authority and government? The president, in a recent radio interview, you know, said that he was unaware of, you know, this. The nurses don't want to call it a strike. This stay away from work that the nurses had. The nurses and caregivers at the Accra Psychiatric Hospital had embarked on. What's the communication structure? Were you surprised by the president's comments?
Again, I wouldn't call that. Well, to an extent, I'd expect that.
Did I just put you in a tight corner?
No, not exactly. You know, the point is that there is a briefing. I mean, they have a system. The presidency has a system of briefing. We, as an authority, we work with the ministry, the Ministry of Health. So we always channel our grievances through the.
Were you surprised by the president's comments?
Well, the president, I know, has been on the road. I mean, he's on a campaign trail. Okay, so
understandably,
it is possible that probably and maybe we need to put what the president said into context, because you had the communications minister coming in to say that the context in which he said that was basically to the striking or so-called, I mean, or supposed striking nurses, and not, I mean, the issue of mental health.
That's my question,
as a whole.
actually.
So, well, I think the issue.
So, in that context, were you surprised?
I want to give him the benefit of the doubt and say that it's possible he was not briefed on it.
Head of communications at the Mental Health Authority. I mean, clearly, you know, the healthcare system in Ghana, mental healthcare system in Ghana, in fact, is really faced with a serious predicament. And until this act, this Mental Health Act, is legally binding, really legally binding, you know, and therefore, you know, bringing some implementation of what your policies, your proposed policies are, I think we'll be having this discussion till eternity. Anyway, you're watching New Day.